The following segment is sponsored by Hometown Pharmacy.
Taking a break from cooking to talk about something really important and something that a lot of people don't want to talk about, but sometimes you have to. Kristen Brown is a pharmacist from Hometown Pharmacy, and she is here to talk all about that dreaded topic of, don't even like the word, lice. Good morning.
Good morning, Amy.
So what do you do?
Well, first, not to panic.
Okay.
The first thing we want to do is panic. Don't panic. I think understanding the life cycle, it affects everyone,
Yes.
all socioeconomic status.
Yes.
And it is not a sign of poor hygiene, what some people think. It's also known, maybe it likes clean hair better. So it is not a sign of poor hygiene. And we don't need to have a bad stigma with it. It just is what it is.
We just need to get rid of it.
We just need to get rid of it, exactly. So understanding the life cycle, I think makes it a little bit easier to understand, and you can figure out where in that life cycle we can stop it from reproducing and just move on.
Now, you brought along a couple of products here.
Yeah.
Let's talk about, what you got here.
Sure.
and your advice.
There are a variety of ways to treat it. There are over-the-counter options, and I brought a couple along, and then if these fail, there are prescription options you can go with.
Okay.
These are going to be $25 or less.
All right.
If you go with a prescription option, you are looking at going to the doctor's office to pay a copay and $200 plus for the medications
Got
for
it.
insurance.
So first start with
first
this.
line this, and these things are effective. So my favorite one is going to be Lice. A generic product that has the same active ingredient is good too. It's a two-step process. So in the life cycle of the lice, you want to go ahead and treat the active treatment. You only treat if you have live lice. If you just have nits, it's not necessary to treat. So go ahead and treat when you have the live lice. You put this one, you wash your hair, put it in wet, get it all through, leave it for 10 minutes, rinse it off. Key is to go ahead and repeat this in 9 days. Then you're going to go ahead and kill all of the lice that survived the first treatments. They may hatch, but they're not old enough to lay eggs yet. So you can kill those and should essentially eradicate the infection. The reason I like this one is because after you rinse it out, it is supposed to stay on the hair, and that can help if others hatch in the meantime, so it has that residual effect. Modern shampoos make the hair pretty slick, so they make that less effective. So I would still repeat it in 9 days, even though essentially it could be taken care of in one treatment. This is Rid, also a good product, but there are a few more people that are going to be allergic to this one. I'd still do the same way, treat it twice. This one goes on dry hair, so difference, wet hair, dry hair.
Got it.
And again, repeat in 9 days to make sure you stop it twice. You get the active ones, and then you stop it again in the life cycle before it's able to reproduce again.
Good point. Now, you brought a comb around.
Yes. So once you have treated, the second step is to go ahead and go through and actually manually remove the nits from the hair.
Okay.
The nits are those little casings, the white, they're empty, and those are not viable eggs, but you'll still want to get rid of them.
Okay.
And lice want to be close to the scalp. So you want to make sure you get all of them within a centimeter of the scalp. Those further out, they aren't close enough to be warm enough to hatch, so likely they aren't going to hatch and cause a problem.
Got it. Now, you brought along some things. We talked about for a minute about sometimes we overtreat. So, and you talked about nits. So you've got some other things here.
Yes. So sometimes people think this is a little bit harsh. This is the most studied and least toxic product too, so that is a good one to go with. But if you want a more natural option, Fairy Tales shampoo has some essential oils in it. These things are not FDA approved, but it still feels like you're kind of putting up a fight. So if I can make my child's hair less favorable to a lice infestation, I am going to go ahead and do that. So we carry those products, and I use them on my kids themselves. Now, there is a method that kind of can suffocate the lice, and that is with using the Cetaphil skin cleanser. And don't confuse it with the moisturizer. You want to make sure you use the cleanser.
This is like the soap, right?
This is like the soap. Go through and put that on the dry hair, completely soak it, and then use a hair dryer to dry it, and it'll almost make like a little saran wrap around the strands of hair and suffocate the lice. So a little bit more natural way to do it. There are directions all over the internet on how to do it, so you can get detailed instructions there. And this one you would repeat 3 times though, once a week, every 7 days. But a little bit maybe less harsh, more natural product if you wanted to go with a less less harsh way of treating it.
And this is why we love Hometown Pharmacy, because they are real moms, real dads, real people in the trenches dealing with their own kids and family, and you can ask them advice, and they keep it real. You guys, you're not just trying to sell us something, you're trying to educate us and help us out. So it's awesome. And you can talk to a real pharmacist when you go there. You're not just a number. So lots of locations all over the area.
Yes, I'm at the Neenah location, but we now have one in Appleton, a couple in Oshkosh, Wapaka, so yeah.
Growing
like crazy.
If you need advice, medical
Yeah.
advice, stop on in and check them out. Thanks so much. Really appreciate it.
Thank you. Thanks for having me.
You bet.